Welcome back to BNC Live. As we fight to contain the virus, new data from scientists in Israel show a fourth dose of that COVID-19 vaccine could actually increase antibodies and protection from the virus. According to that data released on Monday, a fourth dose of either Pfizer or Moderna increased the number of antibodies compared to just 3 doses. That's what we currently get. But preliminary research did indicate that a fourth dose provides only limited defense against this new variant, Omicron. All right, here to discuss the COVID latest, we have Assistant Program Director at the University of Illinois, Dr. Christopher Colbert, friend of BNC Live. Always a pleasure to have you, sir. So this new data coming out of Israel shows that a fourth dose, right, of a COVID vaccine could increase antibodies and protection from the virus. What are your thoughts on that? Should the U.S. possibly consider that?
Well, again, this is a positive outlook on further insight on how we can better address and manage COVID-19. Now, specifically in reference to the data from Israel, that is a very specific hospital that is utilizing this fourth vaccine on specific patient population, and that's the healthcare providers as well. So that's a specific patient population. So you have to look at this data and realize who it reflects and what the outcome is. It's a positive look on enhancing immunity and enhancing protection. There's a significant amount of information that we could all gain from this. And as data is collected, we can move more forward in managing this concern and having resources that can enhance our collective immunity.
Yeah, they rolled out that fourth shot on folks over 60 and also those in the healthcare field. But is that enough to protect people from the virus and also limit breakthrough cases? Or is it too early?
And so that's the big thing. How do you define protection? And protection is decreasing symptoms, decreasing admissions, and decreasing the severity of the disease. And I think it's extremely important that we craft our delivery to the public so that it's consistent. And that goes with defining what works and what our expectations are. So anything that enhances immunity and decreases severity is what we're looking for. And that's a realistic goal. To assume that this will alleviate a virus is unrealistic. The role of this medicine is to decrease the symptoms so that we can manage these moving forward.
All right, well, let's talk about managing. How much longer, Dr. Colbert, will we remain in the pandemic phase of this virus? And eventually, could we be transitioning to an endemic chapter? Please tell me sooner rather than later. I'm exhausted.
That's a very good point you make. And I think if we're having this conversation of endemic, it's already here. And it's been here for going on for 2 years, addressing these variants, changes, and the dynamic process of this virus. And I think it's a point of recentering our conversation into moving forward, knowing that this virus is here and making the adjustments that will assist all of us moving forward. As an example, focusing on resources and our precautions. There are more individuals that are vaccinated in the United States than ever before. They are making tests available as well, so we can better identify those individuals and decrease the spread of these concerns. And that's a part of moving forward, accepting this as a transition from a pandemic to an endemic.
Yeah, learning to live with this virus. Dr. Colbert, what message do you have to our audience, sir? I mean, we're all kind of anticipating yet another peak or this peak to level out. What do you say to them? What's your message?
The biggest message is to adhere to recommendations, that there is a light at the end of the tunnel. And that light at the end of the tunnel is not a train. It's understanding shared responsibilities, wearing your mask, receiving the vaccine, and enhancing the dialogue and expanding the conversation on how we can all move forward. Those simple ideas will transition all of us to move to a better place.
All right, Dr. Christopher Colbert coming to us from Chi-Town. Thank you, sir. We appreciate you taking the time to chat with us. Our pleasure.